vaccinate as many people as possible. If that is not possible, we should really expect that new variants will definitely emerge. And the characteristics and nature of this new variant is really, it will be a question mark for everybody.
The last question from James, he says, has the world forgotten the pandemic due to the reduced infection rates and the war in Ukraine?
The world has not forgotten the pandemic, but what I keep insisting on this press conference is that it's a reasonable sign of optimism in countries that are vaccinated at scale. Okay, you see a restriction being lifted in many of these countries, which is reasonable. It offers hope. But we should be cautious that for countries that have vaccinated, have not vaccinated to that sizable level, there's still a tremendous risk out there. So we cannot generalize the optimism that we are seeing across some countries that have vaccinated at scale. So COVID is still out there. COVID is still poses a serious security threat for all of us. And until we make sure that the threat is taken care of everywhere, it will continue to be a threat everywhere, even in those countries that have been fully vaccinated. Of course, the going on in Ukraine has taken a lot of attention away from COVID, and which is unfortunate because COVID has killed now close to 6 million people. That is a lot of people. If the death of 6 million people doesn't shake in any of us, then I don't know what can, in our humanity, shake in us.
Thank you very much. I think we really don't have any more questions coming in now. So perhaps let me hand over to you for a summary of the main points that you want colleagues to take away today.
So I think the main point that I want to take away is really that the overall trends look good on the continent, and we must always pause to recognize the tremendous leadership that the various member states efforts that they are doing to fight this terrible pandemic in bringing down the rates of infection consistently, and they've done this over and over. I think that is said with respect to the resilience countries and the way they have balance between saving lives and saving livelihoods. My second message to all of our member states is that use this period to intensify the prevention activities as much as possible, increase vaccination uptake, decentralize testing, and make sure that we work as hard as possible to increase vaccination uptake together with all the partners. I think these are the things that this low transmission season should offer us, that unique opportunity.
All right. Thank you very much. That brings our press briefing for today to an end. Colleagues, I want to thank you very much for having stayed with us for the past 1 hour and for your very important questions. Let me also thank Dr. John Nkengasong for taking that time every Thursday, as he does, to come and talk to us and update us on the situation of COVID-19 on the continent. A big thank you to my colleagues within the African Union and the Africa CDC, and to everyone else who may have been watching this broadcast. We will be joining you again next week on Thursday at the same time. Bye-bye for now.
Thank you. Thank you.